The American Brain Tumor Association is pleased to welcome you back to our patient and family meeting 3-day series, Brain Metastases, Life After Diagnosis. My name is Emily Lippert, Senior Program Manager here at the ABTA. As a leader of brain tumor education, support services, and research, the ABTA created the Metastatic Brain Tumor Collaborative to inform, support, and empower patients diagnosed with a metastatic brain tumor. Thank you to our collaborators for their partnership of this meeting series. Additionally, thank you to ABTA sponsor Accuray for their support of this meeting. We hope each of you enjoyed yesterday's session. If you were not able to attend live, the recording will be available at the conclusion of the 3-day meeting. Today, we have another excellent topic and speaker. Day 2 of our meeting will focus on how will brain tumors affect my brain, maximizing your brain health, keeping your brain fit. Keeping your brain fit and understanding certain lifestyle choices can help you manage and protect your brain and reduce the risk of symptoms and side effects. Attendees will explore sleep hygiene, diet and exercise, stress management, and more. Our speaker today is Dr. David Piccioni, who is a professor of neurosciences at the University of California, San Diego, and the director of Neuro-Oncology. He specializes in the treatment of primary brain tumors and brain and leptomeningeal metastases with a focus on clinical trials and novel therapies. Thank you so much, Dr. Piccioni. You may now begin your presentation.
Well, thank you for having me. Let me share my slides here. And so, yes, today's focus is really kind of maximizing your brain health and keeping your brain fit. And we want to cover a number of different topics to kind of help you sort of through treatment and beyond in terms of maximizing the most you can sort of get out of your performance in your brain and keeping you in the best shape possible. And so I have no disclosures. And here's a little bit of a outline that I want to kind of talk about what we're going to cover today. The first thing I want to talk about is a little bit of just anatomy and sort of symptoms of brain tumors and what symptoms you have when you have metastases in different areas of the brain. Next, I want to cover sort of those 4 basic concepts of exercise, diet, cognition, and sleep, and what you can do to sort of maximize your health on all 4 of those fronts. So we'll start off by talking about some symptoms of brain tumors and some neuroanatomy. So brain metastases are, very common, and there's hundreds of thousands of cases each year. The most common brain tumor types are melanoma, lung cancer, and breast cancer, but we're seeing brain metastases from every kind of cancer, and all the different types and all the incidence really is increasing year over year. Now, tumors that spread to the brain might be a little different than tumors out in the body, because based on where they land in the brain, they can really affect your sort of functional status and your quality of life. Now, historically, the main treatment for brain metastases has been radiation. Many years ago, it was whole brain radiation, and has evolved over time to mostly stereotactic radiation, although there are times we do still need whole brain radiation. But we've also come up with better systemic chemotherapies and treatments too to help treat tumors in the brain, as more drugs are being designed in a way that they can get into the brain and treat some of those tumors even without radiation. And then there's also sort of novel approaches such as laser ablation. We can go and try to burn out some tumors without larger surgeries, which we sometimes do for large and symptomatic tumors. So from a treatment perspective, which we're not going to focus on too much today, there's been a lot of advances over the years. Now, in a big picture sense, we've really made big strides over the last decade or so in the treatment of cancer. And what that means is that patients are living longer and longer, and that's great news. But with that comes more time that tumors can spread to other parts of the body, sort of including the brain. And the longer people live, the higher the likelihood is over time that things might eventually kind of metastasize to the brain. Sorry about that. And so the brain metastases uh, has originally had a poor prognosis, but we've gotten much better at those treatments as well. And that we've got better and better treatments, some of which I outlined a little bit before, and we're getting really good at treating those tumors as we're spreading to the brain. But those tumors still can cause significant symptoms, both when they land there and maybe cause some initial symptoms or swelling, as well as some other symptoms that happen, even after you've treated them. And those symptoms can really affect cognition and really your sense of self. That's very different from tumors that might spread to other parts of the body. And so, because these brain metastases can really affect so many things, they can affect your physical function, and they can affect, different psychological aspects of how you feel or your sense of self. That they're really unique, and we really want to take some specific strategies and unique strategies to really kind of focusing on brain health here. And so now that people are living longer with cancer, living longer with brain metastases, we really want to focus on what can we do to sort of improve people's function and their quality of life once they have tumors that have sort of spread to the brain. And that's really the focus of today's talk. So here's a nice little graphic kind of showing some of the areas of the brain. And I want to just go a little bit over the anatomy, because what happens with brain metastases is your symptoms are sort of unique to you in terms of where different tumors metastasize. And so in a very basic sense, we have sort of the different areas of the brain here. And we'll start sort of with the frontal lobe in blue. And that really has sort of two major functions. The most uh, posterior part of the frontal lobe, the part that's touching the red part, is where all of your motor function and your strength really resides. But as you move forward to the rest of the frontal lobe, you really have the things that almost more make us us, in terms of they really help with really thinking, reasoning, mood or depression, really help with really planning complex tasks or complex activities. And so the frontal lobe is responsible for a whole lot of things there, depending on where in the frontal lobe is affected. Moving on to the parietal lobe and starting with the part of the parietal lobe in red there that's just behind the blue part, that's where your main area of sensation is. But the parietal lobe also takes care of a lot of other processing factors, including kind of where your body is in space, as well as sensation, and some things like reading or kind of knowing your right from your left, and really kind of understanding how and where your body exists in space. In yellow, the temporal lobe is, has most of your areas for language and memory. And in purple there, the occipital lobe is really vision and visual processing. The cerebellum in the underside of the brain really helps with sort of balance and coordination. And the way I like to envision the brain is almost like a funnel, where all of those different areas, all those neurons that are kind of wired together, really have to get out to the rest of the body. And so that neck of the funnel is the brainstem. And while the brainstem does have some functions in it that are very core functions like heart rate or breathing, they're also kind of like the grand central station of getting all of those signals in the brain kind of out to the rest of the body. So everything kind of coalesces into the brainstem and then kind of passes out to the rest of the body. And therefore, because a lot of that wiring kind of runs through that very narrow neck, small metastases there can sometimes affect lots of different functions at once. So just as a little example, we have a picture over here on the right of a patient with brain metastases. And at the very top of the brain, you see two little white spots there where they have two tumors, one in that posterior part of the frontal lobe that controls strength, and then one right behind it, kind of in the sensation part that might control, that's controlling sensation there in the parietal lobe. And then you see two larger ones down in the cerebellum that could control balance. So in a patient like this, they might have weakness and numbness of a limb, as well as sort of general difficulty with sort of balance and coordination. You can see just from a few small tumors, a number of different areas could be affected. And that's what kind of makes everybody's brain tumor and brain metastasis journey unique in terms of where their tumors are and what symptoms those are causing. So moving on from just the general sense of neuroanatomy, let's just kind of think about cognition in general. And a lot of that is in the frontal lobe, but really kind of using all the different parts of your brain. But there are so many factors that really kind of contribute to the way you think and could be affected and affect the way you think. Starting at the very top of the graphic here, tumor treatment in general can play a role. Whether it's sort of chemotherapy causing some sort of chemo brain where you sort of have decreased cognition because of that is one major factor. Radiation to the brain can help control tumors, but sometimes can also um, lead to issues with wherever that tumor is or wherever that treatment is. If we kind of move forward, you kind of think about really where you're kind of starting from in terms of if you have other things going on. And so anxiety and depression, if you had those before your diagnosis, are already things that kind of affect cognition. Anxiety in particular can really affect the short-term memory circuits and make it hard for people to sort of concentrate or make new memories. If you're already, have a diagnosis of anxiety and then you have this diagnosis of cancer or a brain tumor on top of it, that might make things worse. And that can really exacerbate the way you sort of think or remember. Everybody's also starting from a different place. As our brain originally grow, they sort of peak out around age 25 or so in terms of maximum development. And we do slowly have some age-related changes over time that happens to everybody, even people without cancer or brain metastases. And so all our brains are sort of changing in that way over time. And we have different educational levels in terms of the complexity of thinking that we needed to do either for our education or our job that can kind of affect our baseline function as well. Other medical problems can contribute to the way you're thinking and and really kind of affect your sense of self sometimes as you're dealing with other medical illnesses, even separate from what's going on with cancer or brain metastases. One of the biggest things for me that I see really that affects cognition is fatigue. And if you think back, all of us when we get tired really are not functioning at 100%. And I think that's a very just simple way to sort of say your brain does kind of tire out just like anything else. And so if you're up for long hours at a time or physically or mentally you're doing something strenuous, your cognitive capacities sort of diminish over time. But fatigue also gets exacerbated with cancer and cancer treatment. And so if you think about just that, their brains get tired. But on top of that, you're very tired from other things happening to your body at that time. That can really affect the way you're thinking and your sense of self. Lots of medications can affect the way you think or the way your brain processes information. And some of the biggest culprits are medicines we use in brain metastases. So brain metastases patients that are at higher risk for seizures or often have seizures and are on seizure medicines, and they can kind of slow down the brain to a certain extent and affect the way things are thinking and processing. We use steroid medications to reduce symptoms of brain metastases, and that brings down swelling and can make some symptoms better. But steroids are a double-edged sword that have a lot of side effects as well. They can give insomnia or agitation or irritability that can affect people's sense of well-being. And so these are things we kind of have to manage and think about when we're dealing with patients or in terms of what things we can do to really help make them better as we manage these things, trying to manage their symptoms, but also the side effects of some of these medications. We talked a little bit in the last slide about tumor location and biology. And so as tumors are in different areas of the brain, that's going to affect how you process information, how you see things, or how you see things in space or be aware of things in space, as well as how you kind of do more higher order thinking in terms of planning complex activities. And then last but not least, there's a lot of environmental influences that affect you as a person and affect your brain and your brain function. One of the biggest ones that we'll talk about is stress. And so other stressors, much like fatigue, kind of wear on the brain and really don't have you working at 100% as much as, all the time. And so you need to kind of be aware of all these factors and treat the things that are in your control to try to improve your sense of well-being and your sense of brain health. So the first topic I want to talk about a little bit is exercise. So here's a study here that was a review article, and it was actually, it reviewed 15 studies, and they looked at physical activity in patients who had primary brain cancer. Now, these were not brain metastases, but these were people who had brain tumors. And just a couple takeaways from this study where they looked at the 15 other studies um, in this review, and they kind of said, in general, most patients really didn't have a really good activity level to start with. That there, some people had prioritized physical activity, but before their cancer diagnosis, a lot of them weren't doing probably the recommended amount of physical exercise. So they weren't starting at the best place. But what they did look at is when patients were able to do some things, they looked at people doing a mix of different things. Some of the studies were aerobic exercise. Some of them were light resistance training, like maybe just with like exercise bands or very light weights, or doing activities like yoga. That all these patients who had increased their physical activity, even during their treatment, they reported higher quality of life, and they weren't concerned as much about different brain tumor specific issues. And I say, so in a general sense, what this really tells us is that some exercise is safe. We get that a lot from patients saying, hey, what am I allowed to do? How much can I exert myself? And certainly you can exert yourself to some degree and to various amounts depending on your particular situation. And that it was feasible to do. I know you have a lot going on when you're undergoing cancer treatment, but being able to work it into your schedule was feasible for most of the people. And there was a payoff for it, that people felt better. And I think that's what we kind of want to focus on a little bit more in these next few slides. So this next study it was a study in advanced lung cancer. And so patients who usually had advanced or metastatic lung cancer, not necessarily to the brain, but could be. And they kind of looked at exercise in these patients. And so there was kind of three groups here. There was one group who did sort of exercise, 2 supervised sessions per month, and then kind of given instructions to do some additional light exercise the rest of the time. And they were aiming for 150 minutes a week, which I think is a good goal for some of these exercise programs. I think one question we get a lot is, well, how much am I supposed to be doing and how much am I supposed to be exerting myself? So it doesn't have to be exerting yourself a lot, like we saw from the last slide, but you want a decent amount of activity kind of spread out over the week. And so in this study, they kind of randomized people into three groups. They had people who were in the exercise program, and there were people who were in twice a week Tai Chi sessions. And for those who aren't familiar, these were classes with an instructor, and they kind of focused really on, I think the best way that I like to describe Tai Chi is really sort of meditation in motion, where they kind of did focus on a lot of things such as different light movements, mindfulness, breathing, and were sort of coached through that. And if you looked at these patients, not only did they have improved sleep and less distress than the group that didn't do either of these interventions, but they actually lived longer in this study. And so doing these things to kind of focus on brain health and to really take a little bit of time to do some light exercise, do some of these breathing exercises, focus on these different things can really keep your brain healthy, and that in some cases really keeps you healthy and keeps people living longer. So I think that was a very nice study in lung cancer that was a sort of a larger randomized trial, which we don't always see for some of these interventions. This was another study in brain tumor patients, and these were not brain metastases. These were glioma patients who were undergoing radiation therapy, and their radiation is usually longer than in people with brain metastases, and often sort of 6 weeks or so of radiation. But during their 6-week course of radiation, they enrolled some patients in this study where they did yoga in pairs. They sort of had their caregiver and the patients. And they had these 12 yoga sessions over the 6-week course of radiation. And they focused on a lot of stuff that they did in that other study. They kind of focused on mindfulness exercises, kind of being in the moment, different postures, different breathing exercises. There were guided imagery where people would sit down and just kind of envision peaceful scenarios. And as they did this twice a week for the 6 weeks, they then compared the patients to the patients who sort of underwent this 6 week yoga program with a caretaker, compared to the people who were just randomized to a control, that they were going to do it afterwards, but they didn't do it as part of the study. And really, across all domains that they measured, they really saw benefits. And on this scale, any 1 point difference between the black line and the gray line was considered statistically significant. And so basically, people's mood and their thinking and just their general sense of well-being, all improved. Even some sort of side effects of their treatment, any kind of GI symptoms they might have been having from their treatment, either nausea or constipation, um, all improved doing these twice a week sort of sessions. So this was a very small study, but I think it really, once again, highlighted those things that, hey, these things are feasible to do, and they improve your sense of well-being and overall health. And I think we need to really focus on trying to incorporate some of these things into patients' treatment plans. The next thing I wanted to talk a little bit about was sort of diet and brain health. And here I'd like to start out by really showing that the ABTA actually does have a Foods for Brain Health flyer that you can find on their website that'll be available at the end of the talk. And here's one of the pages from the flyer, really highlighting different foods and what those foods sort of bring to the table and what sort of things that are in them and how those different ingredients sort of help. And so if you kind of look through, they highlight a lot of omega-3 fatty acids and different foods that have those. They kind of focus on things like magnesium that kind of helps prevent headaches, also helps promote sleep, and just different vitamins like vitamin A that might be in different foods, or vitamin D, to make sure you're sort of getting getting all these sort of basic nutrients and vitamins in your diet. And so really the first goal of sort of healthy eating with cancer, or even with a brain tumor, is really making sure you have all the right nutrients to kind of make sure your body can kind of stay healthy, to be able to keep you healthy, keep you have a good sense of self, be able to fight cancer. And in this case, also sort of have good brain function, focusing on a lot of those ingredients necessary for brain health. Now, the problem with recommending specific, you know, supplements or other additives is that we don't really have a lot of data on them. And so there are some small studies in either healthy volunteers for different supplements, or in animal models, or in petri dishes for things that might have anti-cancer properties. But we don't really have anything that we know for sure really in people in a real world scenario can really affect sort of affect brain health, not in the sense of keeping your brain functioning well, but really trying to fight cancer. And I think when people are talking about healthy eating, they're really trying to do two things: kind of staying generally healthy to be able to sort of fight cancer, as well as, are there things that are going to necessarily, kill my cancer or help fight my cancer? And in that second category, we just unfortunately have a lot less data. Now, there's lots of stuff patients want to try, and I don't want to discourage them from doing that, but there are a couple caveats that I really kind of want to cover here. So if there are any supplements that you're interested in taking, I think you really want to review those with your oncologists and your radiation oncologists before starting them. Unfortunately, some supplements may interact with different medications you're on, or even your treatment. And so that's why I think having these discussions is important. For instance, antioxidants are very strong anti-cancer, molecules, but they can potentially interfere with radiation treatments and maybe lessen the effect of radiation. And so one thing often the radiation oncologist will do is kind of talk to patients about, reviewing different supplements that they might be on, and just having them hold them just for their few days of radiation. This isn't something you have to stop in the long term. You're really just something you might want to stop just for a few days before you get any kind of radiation treatment, and you can kind of resume them afterwards. But it's those kind of discussions that are important to have. Similarly, if you're talking to your oncologist, there's a lot of things that you might see either for brain health, or that might, in theory, have some anti-cancer properties. But if those interfere with your other medications, or other treatments that you're on. Something like ginkgo biloba has some data behind it in terms of improving your brain function, but the way it's sort of metabolized can really interfere with a lot of different medications and or chemotherapy treatments. And so you have to really make your doctors aware and really kind of review your medications either with a pharmacist or your oncologist to see if, hey, if that's something that's a good thing for me to take. And even if it has some positive benefits, you have to make sure it's just not interacting with other things. What I often tell patients to do in this situation, because patients are often wanting to try different vitamins or supplements, and I kind of give them two pieces of advice. One is that unfortunately, a lot of these supplements aren't regulated, and so you're never sure exactly if what's on the label is what you're getting. Now, companies have been better about that in recent time, and there's also some third-party companies that try to sort of verify the ingredients. So I think those are helpful steps. But sometimes supplements can have additional things in them that aren't in the label that could also be interfering, and that's something that's important to keep in mind. Supplements are not necessarily as safe as everyone reports them to be, and that they can, affect your liver or interact with other things. And you have to be careful that that when you're getting supplements or you're doing other things to your diet, that's not just foods, but you're sort of adding in other additives that your body's going to be able to process those, and that they're not going to interfere with other things. I have seen people have liver damage from other supplements that people thought were benign, and it sometimes takes a while to figure that out. But getting back to the fact that patients have a lot of stuff that they want to try, and so how do you do that in a safe way? And so one of the things I tell people to do is if you're kind of getting started on your treatment and you're on your sort of chemotherapy or immunotherapy, um, do that for a month or so and see how your body tolerates just that. You'll be getting regular blood work. You can make sure your liver function is okay and your kidney function is good. Your bone marrow is making enough blood cells that you need. And then kind of add supplements in sort of one by one, month by month, and kind of see if all your numbers stay good. And if they're good, then it's not interfering with anything. And if you think it's something that could be beneficial for you, then hey, it's good to take. But if you're doing that along the way and all of a sudden your liver numbers go up or something happens to your kidneys, whatever's in that supplement, whether it's supposed to interfere with those organs or not, maybe that's not a good idea. Maybe you stop that one, make sure everything improves, and kind of move along to the next thing that you're interested in taking. Lastly on all of this, I think a referral to a dietitian is really helpful, both to review your initial diet and intake, see what other things that you could be taking, um, and make sure that you have a good plan to really get all at least the basic nutrients and the basic vitamins and building blocks for both healthy function in your body as well as sort of healthy function in your brain. So that's a resource that not everyone takes advantage of. I think more people should, is really getting that referral to the dietitian to really kind of help with mapping this out for you. Now, coming back to the point of different supplements to fight cancer, and I've seen a lot from a lot of different patients about melatonin being potentially helpful to fight different types of cancer and to fight brain metastases. And there were some non-randomized smaller studies that even suggested in people that might have a benefit. And I bring up this study. There was a larger randomized trial from RTOG, the Radiation Therapy Oncology Group, of melatonin to really kind of show how even you see all this kind of stuff out there on the internet that something might be very beneficial, at least as an anti-tumor property, that might not play out when you actually test it in a big clinical trial. And because these things are expensive to run large trials like this, many supplements don't get tested. And so the shorter answer is we don't know the answer. But I think this is a nice little case study to kind of see to maybe see people's thoughts on this. So in this trial, there were 4 groups. There were people who got melatonin in the morning, people who got melatonin in the evening, and then 2 sort of historical control groups. And they gave a pretty high dose of melatonin. They gave 20 milligrams. And at the time, there was a lot of thought that if melatonin was going to be helpful as a cancer fighting supplement, you needed it kind of in the evening. And so that's why they kind of were looking at the morning and the afternoon here. And in this larger randomized clinical trial, at least in terms of people living longer, everybody lived the same length of time, that either the morning or the evening melatonin didn't make much of a difference. If anything, the blue line of the evening melatonin, probably did the worst, although there was no statistical significance there. The other thing I'd like to point out is that, we think of something like melatonin as very benign, but when you actually kind of study it in a perspective way, that these things can have side effects and toxicities. And so almost a quarter of the patients in this study, 23 out of 126, had what we call grade 3 or 4 toxicities. And so these are, if this was a chemotherapy, if this was an actual medication, that means it was toxic enough that you need to stop the medicine or the treatment. So that was 1 out of 5 people. That's not 100% benign. Now, in this case, many of them was people just so tired they could barely function, but something you kind of have to be aware of. Now, this isn't to say that melatonin isn't a good thing to take. We're going to kind of close out this talk at the end about sleep. And while they were really looking here, and with the people who set up this trial, they really thought melatonin might have a survival benefit, that people might live longer taking melatonin, and that wasn't the case here. But sleep is important, and we're going to get to that at the end. And that is, obviously, melatonin is very helpful in promoting sleep. And if you need that to promote sleep, that's going to improve your brain health as well. So you kind of also have to look at the question that's being asked, and really kind of make a decision from there of what's the best for a certain dietary supplement. The next thing I want to talk about a little bit is sort of cognition and mood. And so one thing that we kind of touched base on early on that I think is very important is, having, behavioral or psychiatric symptoms can really sort of affect your sense of well-being. Getting those treated really can, significantly improve people's quality of life. So the ABTA does have this brochure, and here's a link to their website that has brochures on a number of different topics, that can really kind of help people kind of identify and treat different psychiatric or behavioral symptoms that people are having. And they can be having them for a whole bunch of different reasons. So tumors in different parts of the brain can sort of cause some of these behavioral issues. Age, as people get older, they have more of these symptoms or other health conditions. We talked a little bit earlier about steroids, which can make people very irritable or agitated, even if we need them to treat symptoms and brain swelling. And other medications like steroid medications can definitely affect people's mood. And so going through this brochure, they really kind of talk on, hey, let's try to figure out what's the cause of some of these symptoms. Do we need to do a brain MRI to look for things, or treat other tumors, or treat swelling? But also, have a multimodal approach where we're really talking about counseling services or therapy, and different sort of lifestyle changes such as stress relief or working on sleep. Medications for depression are very important, I think, in the treatment of brain tumors. It's not necessarily, both getting diagnosed with cancer or even metastatic cancer or brain metastases can certainly be overwhelming, and having support services that might be the form of counseling or medications is certainly very helpful. But one thing we kind of talked about a little bit at the beginning is especially in the frontal lobes, is part of where your sense of mood resides is really, in your brain. And if you have a physical problem interfering with that, if you have a tumor there or a treated tumor there that might have damaged some of that surrounding brain, that's kind of like a broken arm. It might not necessarily get better on its own. You kind of need a cast, or you need something sometimes to really help fix that physical problem that's happened, that's kind of leading to these mood symptoms. And that's where I think medicines for depression can be very helpful. So one of the things I think you really want to focus on is getting a neuropsychological assessment. And this is really asking what's changed in your brain now that you have tumors that have kind of metastasized to the brain. And you do this through getting a referral to a neuropsychologist. And they kind of put you through this sort of up to a 4-hour battery of tests where they're really trying to figure out exactly what's changed in your brain and what issues you have in terms of the way you process and think about things. They often break this down into 4 domains or so, where they talk about verbal memory and learning, your processing speed, your executive function, which is really being able to do complex tasks, and really kind of your attention. And they sort of compare those numbers to other people your age. And then they have a follow-up appointment where they kind of show you the results and they start to talk to you about adaptive strategies. So here, this was a number of different studies looking at cognitive rehabilitation domains, and they looked at those 4 domains, and they had different interventions. And they did these for both primary brain tumors as well as metastatic tumors, as you see over in the histology on the right. And some of these were little iPad sessions or even virtual reality sessions or some inpatient counseling sessions to kind of come up with strategies to sort of how can you fix these different problems specifically, because everyone's going to have a unique mix of deficits based on where different tumors are, and you need your own kind of unique strategy to address that. Just looking at your general health across the bottom here, not only we've been talking a lot about the cognitive aspect of that, which might also include speech therapy if your language is affected. We've covered a little bit about the emotional aspects of that, getting psychiatry or other therapy sessions or medications for the emotional component, or even spiritual services. As well as kind of getting social work involved on the psychosocial thing. What things can make your life easier? What caregiver resources are there, or respite care that people can get, or transportation through their insurance, or other things that can really help them as they're on this brain tumor journey. And then lastly, the physical aspect. If tumors are really affecting physical function of your brain, what things to do to kind of get your strength or balance back up. And we really kind of need this multimodal approach to kind of look at all these different things and have strategies to approach all these different arenas. This was an interesting study that actually surveyed both patients and their sort of relatives and caregivers about different areas of their life and what things they had deficits in. And you see across the top, the kind of the biggest thing was actually work, where nobody had no complaints. Everybody kind of felt in the work and education department in the field that there was at least some deficits, and they could kind of sense that they weren't, cognitively at 100%. But also you see here that all sorts of different things, from leisure and travel and driving and finances, and all these different areas were affected, at least in some degree in most patients, including other activities of daily living, things like cooking and grocery shopping, but also even how social contacts, how people interacted with their friends, and trying to make time for that, and really keeping those emotional connections while they're trying to go through treatment. And so, talking a little bit about some of those adaptive measures as you look at those different areas, we can kind of talk about things like work and school accommodations, having meds for travel or travel plans. Here in San Diego, we have driving rehab or driving physical therapy, where people, if they don't feel like they're comfortable back up on the road, they can actually take them out on either a virtual reality or an actual course and sort of test them before saying they think that they're safe to drive or not. Or having sort of pill boxes, assistance from family, and meal prep services, or now grocery delivery, that can all sort of help in some of these domains with some of the things that people cognitively might be having issues with after their brain metastases. And so the strategy for really cognitive rehabilitation is really determining your strengths and your weaknesses, finding out ways to address those deficits, and then sort of adapting those skills into sort of your daily life. And some people use this 3A model of acquisition, application, and adaptation, where you got to figure out what your strengths and weaknesses are, and start to learn some skills, and then start to apply those skills to the real world. And that's really the cognitive rehab plan that we want in a general sense. Now, in a more specific sense, as we've talked about before, everyone's kind of different based on where metastases might be. And there's lots of sort of apps that can sort of help with some of that cognitive rehabilitation training. So here's one from Lumosity, just as an example, that kind of shows you they're looking at all these different areas of your brain. And if you open the app, you kind of get that next screen over that says, hey, what skills do you want to practice? Is it memory? Is it attention? Is it speed or language? And then have a bunch of games to sort of show you what those things are like. And then kind of compare you and score you both on how you're doing with other people your age, and then how you're doing over time, to kind of see that you're making improvements. Another game that I like, that I have, this is the Nintendo Switch game called Big Brain Academy. And they basically, I think it's nice that it's almost your sort of sort of unofficial version of that neurocognitive assessment. You can really try to get a sense of what things that you struggle with versus what things that you're good at, and then have different games to sort of improve them. And you can kind of see in sort of graphic ways how people do. And so these activities are things like, for instance, one of the games here is this block counting game, which you see up in the top left, and they ask you how many blocks are there, and you have to kind of visualize the blocks that you can't see. So you might only see 11 blocks there to the eye, but you have to know to hold up the blocks in the back. There's blocks back there, and the correct answer is 16, and sort of move forward. Or in the bottom right, I put one where you basically have to pop these balloons and you had to go from lowest to highest. And so there you're trying to compute. And so not only are you working on processing speed, but you're working on these different areas such as, visualization or computing or analyzing. And what I tell people to do when they have these apps, no matter what you use, and there's a whole bunch of different ones out there, I just put two up here for examples, but you want to figure out what your deficits are and then focus on the deficits. You have the kind of, in the top right here, you see whoever this person's score is, their memorized score is great, and maybe they're not so good at visualizing and computing. So you got to go to the visualizing and computing games, and those are the ones you got to focus on to sort of retrain your brain and help address those deficits. And the last topic I want to kind of focus on is really sleep and brain health. Sleep is very important to your overall sense of well-being, cancer or no cancer, but certainly a lot more so, both when you're undergoing treatment as well as if you have brain metastases. And some of this information can be found from the NIH website, and you can see that across the bottom here at nih.gov dash sleep. And so a couple things that's good for all of us is that hey, you want to focus on good quality interrupted sleep. And I think you have to then, and then we'll talk about strategies for doing that. You want to try to be getting 7 hours or so of sleep each night. I think it's very important to wake up have regular bedtimes and regular wake up times. It really kind of gets you on a more regular rhythm and schedule. And then trying to get exposure to sunlight, that kind of helps your circadian rhythm and kind of helps get you in sort of a good natural rhythm. And all those things are good for promoting brain health in general. And so the last thing I wanted to focus on was really sort of some tips for getting a good night's sleep. And some of my patients know I kind of give this little sort of sleep hygiene talk to them about a number of things that are here that really can kind of help all of us really get better sleep at night. And so covered a little bit of these on the previous screen where you want to go to bed and wake up at the same time every day. You want to get some sunlight. One that I'm all guilty of is you want regular exercise, but you don't want it too close to bedtime. That kind of wakes up your system and can kind of keep you awake. Naps are good, but you don't want to take too much naps during the day. And I know some people, especially undergoing cancer treatment, can be very fatigued. Take some naps when you can and take them earlier in the day, and then try to get to a normal bedtime. And that's going to try to keep you on a regular schedule. That's going to overall improve your brain health. You want to avoid stimulants like caffeine and nicotine and alcohol, which we don't always think of as a stimulant, but as it gets metabolized, can kind of stimulate the brain too. Again, large meals, late night snacks. There's a number of things that we're probably all guilty of that we can do to kind of try to get a better night's sleep. Getting a good sleep environment in a cool sort of place. Temperature can really be helpful, both putting you to sleep and waking you up. Cooler temperatures actually kind of help you fall asleep, even if you cuddle up with like a nice blanket. And if you somehow have an adjustable thermostat and start to warm the room up before you wake up, that warming up also kind of wakes your body up and wakes your brain up and kind of gets you on that regular schedule. The biggest thing we have now is really screen time. Bright lights, which come from TV and phones and even clocks and computers, that those things kind of wake your brain up and make you think it's daytime. There's a number of blue light filters that can sometimes help with that, as well as just trying to avoid those things. And so the best thing to do is really before you go into bed, have a plan where you're doing something that's maybe not screen related. You might be listening to music or reading a book with some dim lighting, and avoiding electronic devices. You might go take a hot bath, and that'll kind of help your body sort of adjust and relax. And the biggest thing all the sleep hygiene people tell you about is if you're really in bed and you can't sleep, don't sit there tossing and turning. And so if you're there for more than 20 minutes or so, get up, do one of those relaxing things, again, without a lot of light or screen time. If you can, you know, do something that's not very mentally stimulating, but kind of some very light reading. I kind of go read Calvin and Hobbes or something like that, just something that doesn't really have to engage your brain, but is kind of nice and relaxing. And then go back into the bedroom and kind of lay down and try to go to sleep again. Also talk to your doctor about different medicines. There might be medicines to help you fall asleep. We talked a little bit about melatonin and trying to get you on that important sleep schedule. One thing I didn't talk too much about is that sleep schedule is also very important for seizures. Brain tumors do cause, seizures, and seizures can sometimes affect both your sense of well-being as well as your cognitive function. A lot of times seizures are unavoidable, or what triggers them is not known. But there's a couple factors that do control seizures. And so some of those things are not getting good night's sleep, not sleeping regular hours, and doing a lot of stimulants, especially things like caffeine. And so if you can kind of control those things, not only are you promoting brain health in terms of not having seizures, but also sort of these general sleep hygiene issues. And so really, in summary, really the things you can do to improve your brain health and brain outcomes is really working a little bit of light exercise into your schedule. Even if it's just light walking or meditation or mindfulness or even very light weights or resistance bands, it doesn't have to be a lot. Maybe aim for that 150 minutes a week kind of thing. But working that a little bit into your treatment plan both improves your sense of well-being as well as potentially your outcomes. In terms of diet, you want overall healthy eating. Make sure you're getting all the right nutrients, micronutrients and macronutrients, vitamins that you need to eat. But then really review any other supplements you want to take on top of that with your doctor and add them in sort of a staged way to make sure they're not interfering with anything else. In terms of cognition, you really kind of have to see what these brain metastases are affecting and kind of get either some impromptu testing with some of these brain games or more formal neuropsychologic testing, where you can really figure out what those deficits are and really come up with strategies to address them. And then on top of that, anxiety and depression really makes all of this worse. And that's one of the things I think a lot more brain tumor patients need to take advantage of is really um, having therapy sessions to talk about what's going on, helping with some of these strategies, and maybe even medicines in some cases. And then lastly, if you're not getting good sleep, whether you have brain metastases or not, really it affects your overall sense of well-being. And so you need some good sleep hygiene, really be able to get sunlight when you can, and really be able to sort of keep those regular hours in a regular schedule. And that's just really the best tips to really kind of maximize your brain health for everyone. And so with that, thank you so much for your time. And we have some time for questions here, I think, at the end.
Yes, thank you so much, Dr. Piccioni, for such an excellent presentation and sharing tips to maximize brain health. As Dr. Piccioni just said, we will now take some questions. I see a few coming in right now. If you have a question you would like to ask, please type and submit it using the Q&A button in your Zoom control panel. We will answer as many questions as time allows. All right, so we do have a few questions here about substances. The first one is, what is the suggested protocol for consuming alcohol?
Yeah, that's always a really tough one to do. And again, I kind of have it the same way that I kind of talk about some of the other nutritional supplements, and that is you really got to make sure you get on whatever therapy you're on and make sure you're doing well on that and make sure you're not having on symptoms of that before you start to add anything else in. I think a little alcohol, if you just have a glass of wine with dinner, most of the time is probably okay, but something you need to talk to your doctor about. And obviously, in excess could really start to even affect your blood counts or affect the metabolism of other things that starts to get a little dicier. So first, kind of get started on your treatment, make sure everything's okay. If you add a glass in here or there, that's probably not gonna do anything. But also follow those sleep hygiene things and make sure you're not, doing it at bedtime or close to bedtime, and really kind of have to work it in a smart way.
Thank you. Our next question is asking about marijuana and THC gummies. So someone's asking here that they use marijuana to help them sleep. And basically, what are your thoughts on it? Is it something that they should continue to do?
Yeah, kind of. Yeah, I think it's the same thing as, hey, it's much like the melatonin story. Are you using this to promote sleep or are you using this to try to fight cancer? Not as much information available or some mixed data on if it really has any anti-cancer properties. And where I've seen people get into trouble is they take massive amounts trying to fight their cancer and I've had people almost comatose because they've knocked themselves out so much. And so you don't want to do that. If you're using it to help promote sleep and that's working for you and you're doing that at bedtime, I think that's a reasonable thing to do.
Thank you so much. Our next question is, someone's asking if you can please clarify the brain benefits of lumosity, which is what you referenced in your presentation. Um,
Yeah, I
Somebody
think
asked, like, is repetition helpful too? That was like a follow-up question.
yeah, it's tough for all these things because while you can kind of identify what your weaknesses are and kind of see, strategies to improve them, at some point you're just kind of the real question you're asking is, are you improving just in the game or are you improving your overall brain health? And that's a harder question. And I think both of those things are probably true to a certain extent. The nice thing about these different apps is that there's a number of different games per se to improve that one particular area. So yeah, if you're kind of just playing this one game over and over again, maybe you're just sort of improving your ability to play that game and not really improving your overall cognition, although it's probably helping. And so using multiple apps or using different strategies, you might start to help sort of retrain your brain here. And so this brain training is really, we see this a lot more in traumatic brain injury or in stroke, where the brain has plasticity. The brain can sort of rewire a little bit after trauma. And so you're trying to stimulate that in some way. And so there's a lot more data in brain injury or stroke where you're trying to rewire the brain to get people to improve. But that's still the same concept of both physical therapy or maybe speech therapy, is you're giving yourself activities to try to stimulate that plasticity and get some rewiring happening. And when you do physical therapy and you do speech therapy, you don't do the same activity over and over again. You start, and then as you see your therapist week by week, they kind of change up the exercises you're doing. And so if you're just in an app and you're just doing one game over and over again, you're not improving in that sense, or you're not changing it up a little bit. And that's something you do have to sort of be aware of in the big picture sense.
Great, thank you. Our next question is about the ketogenic diet. Knowing that this is something a little bit controversial in the cancer space, any specific thoughts on it?
Yeah, I get, I run into people doing lots of different diets. And so again, you have this sort of mixed data. Hey, people want to do something to try to potentially help their cancer, as well as, sometimes these diets are very restrictive or very difficult. And so I kind of say to people, in the absence of data, do what's comfortable to you. And again, working with the dietitians is very helpful here, still making sure you're getting other nutrients that you definitely need. So, um, you shouldn't be pressured by family members into doing a particular diet when you don't have any clear evidence that something works. But if it's whether intermittent fasting or ketogenic diet or other different diets, and you're like, hey, I think this might help, and even if I'm not sure, I want to try it and I'm happy doing it, then I'm very supportive of that.
Great, thank you. Our next question is whether the prolonged use of over-the-counter melatonin as a sleep aid can cause any sort of brain damage.
Yeah, your body does make a little bit of melatonin, and these supplements are actually doing it in huge excesses. So it really becomes, have you affected homeostasis? Have you affected your body's sort of natural balance and production of these things? Um, when we do these melatonin supplements, we're trying to get very, high amounts into the brain. And so they're much, both the timing of them and the dose of them is not really physiologic. And could that sort of make your body not maybe produce melatonin as much or rely on it in the same way? That's possible. But I think as long as you kind of are on the supplement, then you're kind of getting that from the supplement. And then the question is, if you stop it, is your sleep more disrupted? Have you somehow become a little dependent on it? Do you have to sort of start to make your own and get used to your own natural melatonin again? I think there's data on both ways there. And it is something you have to be a little aware of, but I wouldn't worry too much about it. I think in the short term, if your sleep is poor and we really need to get you sleeping better because that's going to immediately sort of affect your brain health, I think it's better, at least in the short term, to get you sleeping better. And once you're sleeping better, you can either back off or adjust or decide if you still need it or not, as opposed to really kind of struggling and not sleeping well and being so worried about taking something.
Great, thank you. We have another question here about sleep. So you mentioned that magnesium glycinate can help sleep, but does it conflict with chemotherapy?
Yeah, again, all these things that's why I think you have to kind of see what treatment you're on. Everybody's on different things. And so you might affect absorption of different things, or it might interact in other ways. And so yeah, magnesium can do a lot of beneficial things. Obviously, as an electrolyte, you get a lot of it through a whole lot of your foods that you're in anyway, or different things that you're consuming. But are you going to take a lot, maybe even at bedtime, to sort of can help with migraine headaches, can help with sleep, but is it going to interfere with your treatment? That's one of those discussions you really want to be having, with your doctor, and kind of making sure that it doesn't interfere. And if it doesn't interfere and you're getting a benefit from it, then do it. The other thing is test out, these things are all experiments to a certain extent. Test it out and see how it works for you. And if you're not getting the benefit that you want from it, don't keep taking more pills of something just because you think you should be doing it. So it's all trial and error at the end of the day.
Great, thank you. Another question we have here is, you mentioned some types of exercises, such as a mix of aerobic exercise, light resistance, or yoga. But what kind of activities should patients avoid?
Yeah, again, it's going to be a little unique to each person. I think it's very different if you have a very large brain tumor, or one that has a lot of swelling on it. Uh, Sometimes really big straining activities are not good. If in those situations, sometimes flying or going to altitude is not good because your brain can swell, and if it's already swollen, that can put pressure on other things and cause other uh, injury or symptoms. But for the most part, if you have smaller brain metastases, if they're controlled, if there's not a lot of swelling, um, you know, and you're not, trying to bench 300 pounds, but even if you're doing moderate weights or running or doing other activities, that's usually okay.
Great, thank you. Our next question that we have is how to manage extreme fatigue.
Yeah, there's, one of the best ways is really rest. And so I think you do want to, sometimes when people have fatigue with treatment, there's some data that a little bit of light activity is helpful. So if you're tired, to actually go out for a 15 or 20-minute walk, and that can actually sort of improve your fatigue. When you start to have extreme fatigue, where you can feel like you can barely get up, I think you have to start to listen to your body and take naps, ideally earlier in the day, but you kind of have to address those as best as possible. You have to make sure it's not from a medication or some sort of hormone imbalance. So you want to be talking to your doctor about those things. There's mixed data on stimulants, and we said, hey, stimulants might not be the best thing. In some cases, different stimulant prescriptions can kind of help give people a little more energy and a little more alertness. You want to take them as early in the day as possible, usually first when you get up, so that you can be able to fall asleep at night. Some studies say they're helpful. Some studies said they weren't helpful. It's one of those things that if you're in that extreme fatigue situation, you can't figure out what it is, your doctor decides to try it, you have that discussion with them and you try it and you see if it works. And once again, if it doesn't work, you stop it and you look for other solutions.
Great, thank you. All right, we have time for one more question. So this will be the last one. How to best treat and navigate aphasia?
Yeah, so as we kind of talked about here, then there's multiple different kinds of aphasia, and this is where maybe even seeing a neurologist or both seeing with the speech therapist can really kind of help identify the problem, much like we were trying to identify the cognitive deficits with the neurobehavior testing, kind of figure out what kind of aphasia it is. There's in a very basic sense, sort of receptive aphasias, people understanding what's being said to them, and sort of expressive aphasias in terms of talking and getting words out. And so there's different strategies for different kinds of aphasia, and kind of working with everybody to kind of figure out what's the best solution there. Really is more of a unique thing that kind of has to be done through a sort of a speech therapy consult.
Great. Well, thank you so much, Dr. Piccioni. That is all the time we have for questions. If you were unable to get your question answered or want to keep the conversation going, you can join Dr. Piccioni and our day one speaker, Dr. Iser, for a week-long Ask the Expert, which is ABTA's online support community. As you see the QR code on the screen, you can scan it to start asking your questions, or you can go to abtainspire.com. Get your questions answered Monday, April 14th through Friday, April 18th. Thank you so much, Dr. Piccioni, for taking the time to share your insight and expertise. And a special thank you to each and every one of you for joining us for our day 2 of our Brain Mets meeting.
Thank you so much for having me.
Thank you. We welcome you to join us back at the same time tomorrow at 1 p.m. Central Time for day 3, covering the emotional journey of brain metastases. Hear from Betsy Frickles and her patient Jakarta. You can join tomorrow by clicking the same Zoom link as today's meeting. Thank you to our Metastatic Brain Tumor Collaborative partners for their partnership and support in putting together this meeting. Additionally, thank you to ABTA's sponsor, Accuray, for their support of this meeting. For more information about ABTA's programs, events, and services, connect with us on social media, visit ABTA's website at abta.org, or email us at info@abta.org, or you can call our care line at 1-800-886-2282. This now concludes day 2 of our 3-day meeting. Thank you so much, everybody, for joining us, and we hope to see you back tomorrow. Take care.